Hi, I'm Tracy and I'll be your nurse today.
I'm Chris.
Okay, so, and what was your name?
Chris?
Okay. And, what city are we in?
I'm here in Poinciana.
Okay, and about what time is it?
About 6 or 5 or 6 o'clock.
Okay, great.
Not 6 o'clock.
Now start at 0 and count ahead by 7s.
7, 14, 21, 28, 35, 42, 49.
Okay, that's good. Okay, thank you. Now, first I'm going to go ahead and take a look at your skin. I'm looking for the color. I'm looking for uniformity, any wounds, any lesions, any wounds, any lesions on the skin, any dryness, any rashes. I'm going to go ahead and test your temperature of the skin and also the texture. And I'm going to go ahead and do the skin turgor. Okay, good. Now if you could just lower your chin to your chest. I'm looking at your hair to look at the color, hygiene, any dryness, any flakiness. I'm looking at the distribution and for any baldness. If you want to go ahead and put your head back the right way, I'm going to go ahead and palpate the hair. And then for your nails, with the nails, I'm looking at the color, the cuticle. We're looking for any ridges and for any cracks. And also on the feet, the color, the cuticle, any ridges or any cracks. Okay. Can you take your thumbs, place them together? Okay, thank you. And if you give me your hands, I'm just going to go ahead and test for the capillary refill. Okay, that's fine. I'm going to go ahead and take a look at your head and your face, and I am going to look for the size and the shape of the head, and it's also its placement on the neck. And then I'm going to go ahead and palpate the frontal and maxillary sinuses. Is that tender?
No.
Okay, good. Now we're going to go ahead and if you can just raise your eyebrows, scrunch your nose, smile, frown, and if you can make like you're blowing a whistle, and then go ahead and puff your cheeks full of air, okay, and then don't let me blow it out, okay, and then go ahead and close your eyes and don't let me open them. Okay, good. Now I'm going to go ahead and ask you to open and close your jaw. Oh, okay, that's great. Now I'm going to go ahead and I have a cotton ball here. I'm just going to go ahead and let you see how that feels like. Now go ahead and let me know when you can feel that on your skin.
Yep. 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 And yep.
Okay, that's good. Go ahead and let me put my hands like that. Now go ahead and chew. I'm going to feel the muscle there. Okay, that's good. Good. Now I'm going to go ahead and look at your neck. I'm looking for any jugular vein distension. And I'm also going to do a little bit, we're going to have this sip of water. Go ahead and take a sip. Don't swallow. Okay, don't swallow. Okay, I'm just going to get my hand in place. Okay, swallow. Okay. Now take another sip. Go ahead and put your, don't swallow though. Okay? Not yet. Okay, go ahead. Okay, that's good.
Okay.
Yes. So now we're going to go ahead and move on to your eyes. I'm going to go ahead and inspect the eyes. I'm going to look at the eyebrows, the eyelids, the pupils, the irises, the sclera of the eye, the conjunctiva. I'm going to go ahead and also palpate. And does that feel tender?
No.
Okay, good. I do have a little bit of a vision test. If you just hold this at reading distance, and go ahead and tell me the lowest, smallest number you can read.
Three, 7, 4, 2, 5, 4, 2, 4, 5, 8. 3, 7, 4, 2, 5, 8.
Okay. All right. Thank you. Then I did that. Now I'm gonna go ahead and oh, let's try it again with your glasses on. Maybe that'll help.
Yeah.
Since you wear glasses.
Okay. And 9, 8, 9, 3, 7, 8, 3, 6.
Oh, okay.
Yeah.
Okay, well, good. Now, for this portion, I'm going to go ahead and take the glasses like that, just so I can go ahead and I'm going to see the reflection of this light in your eyes. Okay, that's good. Now, what we want to do, it's called the, what we're going to do is we're going to go ahead and ask you to cover one eye. I'm going to cover the same eye. Now tell me when you see my finger in your peripheral vision.
No. 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 No.
Okay. Now cover the opposite. Okay, and now the same. Let me know when you can see my
No.
finger.
No. No. No.
Okay, that's good. All right, so if we can just go ahead and I'm going to ask you to go ahead and follow my fingers. Don't move your head though. Okay? Okay. For the next portion, I'm going to go ahead and take a look at your pupillary reflexes. Okay. Now, I know we're in a small room, but go ahead and look as far as you can, and then go ahead and then let's go ahead and zoom in at something closer, like my hand. So zoom out far away. Now go ahead and look over here at my hand. Okay, good. And let's see. The next thing that we want to do. Okay, so we did the cover and cover. No. Cover one eye and focus on my finger, and now uncover. Okay, cover the other eye. Now focus on my finger and uncover that eye. Okay, good. Now we're going to go ahead and inspect your ears. I'm looking for any drainage, the shape, any lesions of any kind. I'm also going to check behind the ears for any lesions as well. Okay? Also, I'm going to go ahead and palpate the ears. Is that sensitive?
No.
Okay. We have our little thing here. So the first thing we're going to do is I'm going to go like this. Now I'm going to put this on the top of your head and let me know if you hear it the same in both sides or if one side's more than the other.
Right.
Same in both sides or one side more than the other?
Yep, same with that.
Okay, good. Now we're going to do the same thing but only by the ear. And just let me know when you no longer hear the sound.
No.
Okay, tell me when you no longer hear the sound.
No.
Okay, now we're going to do it on the other side. Tell me when you no longer hear the sound.
No.
Tell me when you no longer hear the sound.
No.
Okay, good. So with my line, now I'm going to go ahead and take a look at your nose. We're going to look for any drainage, any swelling, any deviations in your septum, any obvious wounds, or any redness, or any dryness. I'm also going to go ahead and palpate the nose. And then I'm going to go ahead and put these glove on. This glove. And what we're going to do, we're going to take a look at the lips. We're looking for any dryness, any lesions, or any cracks in the lips. You can open your mouth. We're looking at the teeth. And we're looking for any dental caries. We're also looking at the fillings to see if there's any fillings in there. Go ahead and put your tongue to the roof of the mouth. Okay, good. I'm just taking a look at the bottom of the mouth to see if there's any kind of lesions down there. Okay, so also go ahead and open your mouth. I'm gonna take go ahead and open your mouth and go ahead and say ah. Do you have your tonsils?
Yes, I do.
Okay, your tonsils are a grade 1. All right. Now, I'm gonna go ahead and take a look at, I'm gonna grab this, it's gonna taste a little funny, your tongue. Okay. And I'm looking for any lesions at the base of the tongue. Alright. And then go ahead and stick your tongue out and go side to side. Okay, good. Also, if I can go ahead and ask you to look to the left, look to the right, and shrug your shoulders. Okay. Now, push your head to the left. To push your head. Push your head to the turn. No, turn your head to the side. Okay. Turn your head to the right, and then shrug your shoulders. Okay, good. Okay, so we did that. Now, if I could just ask you, if we could just take off your shirt really quick.
Morning.
We're gonna go ahead and do a quick exam. Now, if I hear right now, if I hear anything abnormal in the exam, I'm going to test for bronchophony, egophony, and whispered pectoriliquy. Right? And right now I'm going to inspect the interior chest. I'm looking for any lesions, any bony prominences. We want to look at the respiratory rates. We want to look at the respiratory effort, the use of accessory muscles, and we want to go ahead and look at the posterior anterior diameter. Also for any bony prominences or deformities, right? Then I'm going to go ahead and palpate the chest. Okay. Okay. Now I'm going to go ahead and listen to you breathe. Just breathe normally, all right? Okay, great. So, if I can go ahead, you have some. I'm gonna get this for you, so you have a little piece of hair on your face. If you can go ahead and turn around to the other side, you can. Yeah, just like that. I'm gonna inspect back here. I'm looking for any redness, any swelling, any bony prominences. I'm looking for any lesions of any kind. I'm gonna go ahead and palpate. I'm also going to palpate on your lateral chest. I'm also going to do, let's see, some percussion. Do you hear that?
Yep. Okay. Good. Now I'm going to go ahead and take a listen.
Okay, now I'm gonna go ahead and ask you to say the word 99.
99, 99, 99, 99.
Okay, now go ahead and breathe in and out. All right. Now tell me if this hurts at all.
No.
Okay, great. Now we can go ahead and have you lay down right here. Scoot a little bit closer to the bed. There you go. Okay, so at this point in the exam, I have to state that the S1 is heard at the atrioventricular valve. Oh no. S1 is caused due to the atrioventricular valve. S2 is due to the closure of the semilunar valve. A systolic heart murmur is heard after S1. A diastolic heart murmur is heard after S2. And if I was to find any abnormal results, I would have the patient sit up and lean forward or turn onto his left lateral side as well. Another thing is the 5 points of heart auscultation. It is over the aortic area, the pulmonic area, the Erb's point, the tricuspid area, and the mitral area. And so the aortic area is at the right lateral side of the second intercostal space, and the pulmonic area is the left lateral side and second intercostal space, and the Erb's point is the left lateral side, and that is at the third intercostal space, and the tricuspid area is at the left lateral side, fourth intercostal space, and the mitral area is at the fifth intercostal space, mid-clavicular line, and that is on the left lateral side as well. So first I'm going to inspect this area here. I'm going to look for any vibration. I'm also looking for any kind of pulsations of the heart. I don't see any. I'm looking for any obvious deformities of any kind. I'm going to go ahead and palpate those areas. Okay. I'm going to go ahead and listen to that. I'm going to do it 2 times so I can make use of my bell and my diaphragm. Okay, so that was my diaphragm. Now I'm going to use my bell. Okay, good. Now, I'm just going to go ahead and auscultate over here. No, first I need this on. I'm just going to palpate really quick. I'm sorry. Okay, now I'm just going to palpate for some of your other arteries, okay?
Mm-hmm.
There we go. Now straighten your legs a little bit for me. Okay, just a second. Okay, so I'm inspecting the abdomen. I'm looking for any scars. I see we have one here. I'm looking for any bulges, any lesions of any kind. I'm looking for the position of the umbilicus. I want to look at the contour of the abdomen as well. And I'm going to go ahead and auscultate, okay? Okay, so I'm going to go ahead and lightly palpate. Does that bother you?
No.
Okay, I'm going to do a little bit of deep palpation. Does that bother you?
No.
Okay, so I'm going to go ahead and see if I can feel the liver at all. Go ahead and inhale. Okay, and then I'm going to see if I. Okay, go ahead and. Okay. And inhale. Okay. That was for the kidneys. Okay. Next. So the first thing we're going to do, since we have you laying down, is we're going to go ahead and do a musculoskeletal assessment. If I can get you to pick up your no, stay laying down. Pick up your leg and like swing it over to the side, like just like way swinging, like no. Lay straight again. Like here, let me guide you. Pick up your leg and go. No, keep it up and go all the way this way. Okay, now the other side. Pick it up and then go this way and go all the way that way. Okay, now go ahead and pick up your leg to bend your knee, and then go ahead and put your foot onto your knee and then bring your leg down. Okay, now go ahead and put your feet right here and go ahead and go that way. That's good. Now let's do the same thing over here. Bend at the knee. Put it right here. No, right here. And go down. And then come all the way back up. And then go ahead and put your foot there. And then go back. And then all the way back like that. Okay. Now go ahead and put, pick one to your right leg and bring it to your chest. And then put it back down. And then put your other leg, bring it up to the chest. And bring it back down. And then we're gonna do that one more time. Go ahead and try to push my hand. Okay. Now do that again. And try to push my hand. Okay, good. Let's see. Then, after we did that, we're going to have you sit up. And then we start with the neck. If you can turn towards me. It's okay. You're talking about right here. Okay. Okay, so what we want to do is we want you to put your head to your chest and now look up to the sky. And then we want you to put your head straight. Now turn your head, go back to the other way, and then come back to the middle, and then go like that, and like that. Now go ahead and push against my hand. Okay, good. Now go ahead and push back towards my hand. Okay, good. All right, now we're gonna do your shoulders. So what we're gonna do is go ahead and follow me. Raise your arms above your head like this, cross them, and then go across your body and cross. Okay, now what we're going to do is go ahead and put your hands behind your back, and then go ahead and put them on top of your head. Yep. Okay. Then what we need to do is go ahead and put your hands forward, and go ahead and put your palms up and put your palms down. Okay. Now go ahead and put your hands straight up. Now try to push up against my arm. Okay, now put down against my arm. Okay, good. Okay, good. Now, with your arms straight out, bring your elbows in, and then back out. Now, do it against my strength. Okay, now against my strength. Okay, good. Next, we are going to take the hands and the wrists like this, and go ahead and put your hands down and all the way up, and then go ahead and squeeze my hands. Okay, good. Very good. Now go ahead and stand up. Okay, so turn like this. No, just like that. Now go ahead and reach down to your toes. And then go back up. Okay, now try to lean back. Don't worry, I have my hand here. Okay, that's good. And straight back up. Now take your left leg and go ahead and kick it back like this. Oops. And then go back straight. And then your other leg, kick it back like that. And go straight. Since there's no room, I'm going to go ahead and have you twist to one side. No, like twist. Okay, and twist the other way. Okay, and then go ahead and have a seat.
My cards are on.
Yeah, you can put your shirt back on. Okay, so I think this concludes my test. I'm going to take my 5-minute note break. Orientation, cognition. Have a seat, sweetheart. I think I said that. Neck and veins. I did that. There's that. I don't think I did that. So, did I? I'm gonna do it again just in case. Honey, stay still. It's okay. Okay. Let me just use my knife. Okay. So, just some things that I think I need to go about again. Let me go ahead and feel for your lymph nodes. I'm looking at these parts. Okay. I'm just feeling for any lymph nodes that I might have missed. And let's see, lateral. I want to go ahead and feel for lymph nodes right here. And then I'm going to go ahead and feel for some right here. And then when we did this reading card, I wanted to go ahead and see if I can have you do it again with your glasses on. But we want to go ahead and cover one eye and start with just one eye first. Go ahead and hold it at a good distance. Read the lowest line that you can read.
73925.
Do you see some weird letters as well?
No.
You can use letters like E, M, or W.
M, E, and backwards E.
Backwards E. Okay, good.
X, L, X. 8, 61 over 152. And 20 over 60.
Okay, now try the other eye. Yeah, go ahead and cover that eye, and then read the smallest one that you can read.
Okay. 428-365 WEMOXL 6.1 over 12.2 20 over 40.
Very good, very good. And I also wanted to do this other test where you cover one ear. I'm going to whisper something into your other ear. Okay?
ABC.
Okay, now cover your other ear. I'm going to whisper into this ear.
1, 2, 3.
Okay, very good. And if you just, if you have a chance to, let me just go ahead and inspect your joints and I want to inspect you for your musculoskeletal structures, the muscles in your arms and legs, your joints, making sure there's no obvious deformities or any kind of problems with the musculoskeletal system that I noticed. Okay? Okay, well, it was a pleasure meeting you. Thank you
Thank you.
so much for coming to see us today.
Thank you, Dr. Tracy.